Hello. I am going to share with you my stroke experience and take you along on my recovery journey. Um, a lot of people have been asking me what happened to cause my stroke because I am an extremely healthy 56-year-old woman who's very athletic and active. I have no health problems, no diabetes, no high blood pressure. In fact, my blood pressure runs low. Um, uh, Really nothing. My good cholesterol is high and my bad cholesterol is low, and really have absolutely zero health problems until last Friday. Um, on September 24th, early in the morning, my appointment was at like 8:30. Um, I had an appointment to get a Johnson & Johnson COVID vaccine. I have put this off for a very long time for two reasons. Number one, as healthy as I am, I have a lot of drug allergies. And so I was concerned. I wasn't sure how this was going to play out. Um, and I'm always cautious about taking anything new. So I waited and waited and waited, partially because you couldn't pick your vaccine, and I wanted to pick the Johnson & Johnson vaccine because its base, as far as as I know, I'm not in the medical field. That's my disclaimer. I'm not a doctor. I don't even play one on TV. But um, from what I understand, the Johnson & Johnson vaccine base is most similar to the regular flu shot, which I know I don't have a problem taking every year. So I live in Nevada, in Las Vegas, and I wanted to wait until I could pick which vaccine I got, and I wanted to wait until I could be sure I would be in a medical setting just in case I had a reaction. And it turns out that it was a really good thing that I did that. Um, just to give you a little more background, up until this point, or very recently in the Las Vegas area, and I think most of Nevada, um, uh, your only choices for getting a vaccine was a pharmacy like CVS or Walgreens, or in a parking lot at a pop-up clinic, or at a stadium before an athletic event. And I wasn't comfortable with that. I have had other reactions where I went into anaphylactic shock, and I wasn't going to trust that somebody was maybe going to be around who could save my life if I had that same reaction. So, fast forward now to, um, sorry, this is the stroke. I will do stops and starts. It's just part of it. It's a brain injury. So now I have to tell my dogs to be quiet. Puppies, stop. Go lay down. Um, so um, Now hopefully I can get back on track because that's part of what I'm dealing with too. Um, okay, had to pause for a minute to let the dogs out. Um, so hopefully I can pick up where I left off. Fast forward to Friday, September 24th, 8:30, 8:40 in the morning. I get my Johnson & Johnson vaccine, and because of my allergies, the doctor's office, said that I needed to sit for 30 minutes instead of 15, and so that they could check for reactions. And I did, and I felt okay. Had a little bit of pressure on my throat, which is usually an early indication that my throat is closing. But my body fought it off on its own. I didn't need any epinephrine. My body did what it needed to do, and I seemed okay. And so they gave me my COVID card, and off I went. And as I was walking down the hallway to the main, the building exit, I couldn't walk a straight line. I had incredible vertigo. I was almost passing out. I like held onto the wall and then practically, for my perception, ran back into the doctor's office and told the receptionist, I am not okay. And they did everything right. They immediately got the nurse, and they took my blood pressure. It was through the roof. I don't remember the numbers. I was really in distress and not feeling well. So, but they were like, oh my God, the blood pressure is so high all of a sudden. And my heart rate was like 45. So really high blood pressure, really low heart rate, wasn't feeling great. So I sat there for quite a while, probably about another hour, drank some water, kind of got to the point where I wasn't feeling like I was going to pass out in a minute. And my fiance helped me back out to the car and took me home. The instructions from the doctor was, and the doctor did see me, was if you aren't feeling better in a couple of hours or if you start feeling worse, go to the emergency room. So a few hours later, still wasn't feeling well. And then I started having chest pains and tingling in my left arm. And I thought, heart attack symptoms, I'm going to err on the side of caution and go to the ER. And so my fiance took me. They did everything right. Immediate EKG, took my enzymes, blood test for enzyme levels. But it was clear that I was having some kind of an allergic reaction. So they treated it as though it was just a standard allergic reaction. I got methylprednisolone, which is an injectable steroid, which brings down inflammation very quickly. I was still having that pressing on my throat again, like maybe my body, wanted to go into anaphylactic shock. And so they gave me that, and they gave me Benadryl and Pepcid. And I'm sure you're saying, Pepcid, why Pepcid? But a little known fact about Pepcid is while it helps you with stomach acid, it also is an antihistamine. So I got massive doses of things that would bring down any kind of swelling in my body, which really helped. An hour later, they took my enzymes again. I was not having a heart attack, but clearly something was going on with my heart. And, they said some people have these reactions after they get the COVID vaccine of any brand. That usually it goes away, but if it didn't, or if I started getting short of breath or felt worse, to come back to the ER. So went home and just kind of toughed out Saturday, not feeling good, heart racing, really tired. Not really COVID vaccine stuff. I mean, like heart racing, low heartbeats, at times, like low heart rate at times, and then like pounding heart at other times, lots of dizziness. On Sunday, a new symptom appeared. Every time I would stand up, I felt like blood was pooling in my feet and like kind of from like mid calf or mid, shin down to my feet. I like literally could feel the blood just drain down to my feet. And of course I would get very lightheaded and, hold onto the wall to walk. And it's uncomfortable. It actually is somewhat, I wouldn't say painful, but uncomfortable. It's a pressure that you feel with that. And just spent most of the day with my feet up, napping, still not feeling good. And at about 7:45 in the evening on Sunday, September 26th, my fiance and I were getting ready to watch a movie, and all of a sudden I just said, something's not right. and I knew immediately that I was having a stroke. Um, I'll tell you in a second what the symptoms were, because this is important to know. But um, for those of you who don't know me very well or for a very long time, I'm gonna cry. This is part of what I'm experiencing from the stroke. Is that I'm weepy, even when I'm not sad or feeling emotional, but it just comes. So we're gonna cry together. um, uh, I took care of my mom at home the last 6 years of her life. She was a total care stroke patient. She was paralyzed from the neck down. Um, and in those 6 years, as well as the 2 years before that, that she was in a nursing home, I learned a whole heck of a lot about strokes. I'd like to say I know everything there is about strokes, but I'm quite sure I don't. uh, but I knew enough to know that I was having a stroke. Um, it comes on very quickly, or at least it did for me. Came on very quickly. I felt pain in my head, but I also felt this kind of, I'm going to try to describe this. It's weird, so bear with me. This kind of wash or flood of sensation or movement, almost like blood rushing, um, inside of my right arm, inside of my head, like in like my brain, deep in my head, not surface. Um, the right side of my face started tingling, and drooping, and I felt like a weight on this side. And I immediately said to my fiance, I'm having a stroke. Call 911. He did. He called 911. Sorry, had to pause to blow my nose. He called 911, and the paramedics took a little bit to get here. To me, it felt like forever, because I know that once you're having a stroke, the clock starts ticking from the first moment of your first major symptom, and time becomes critical. If you take nothing else from my video, please, if there's anyone you know who you think might be having a stroke or is having any kind of unusual symptoms, go to the emergency room. Better yet, don't go to the emergency room, call 911. They have so much in that ambulance to help you, that you do not have in your car. So just call 911. Get yourself to an emergency room as quickly as possible. Don't wait. And I'll tell you, something strange happened to me while we were waiting for, actually, my fiance was still on the phone with the 911 operator, and all of a sudden I felt fine, like totally fine. And I thought to myself, have I overreacted? Maybe I'm not having a stroke. Oh, maybe I should just tell them to forget it. And as quickly as I thought that, another rush of that, wash of tingly down my arm and my face, and actually had a huge pain in my brain. And I thought, oh no, I'm having a stroke. I definitely need a hospital. So my fiance hung up with 911 and, unlocked the front door, did all the things, you're supposed to do. And I said to him, because I could feel my right side of my tongue starting to go numb, and I was having trouble speaking already, I said, get me a pen and paper right now while I can still speak and I can still write. I have to tell you some things that are very, very important. So, what was it that I told him? And I wrote it down as quickly as I could, because you don't know how long you're going to have the ability to speak, to write, to think, even. And I knew it was critical that he had this information. The first things that I wrote down were my drug allergies. I usually wear a medical alert bracelet, but as luck would have it, it broke. I haven't had it repaired yet. And so, next best thing, I quickly wrote down what I was allergic to, most severe to least severe, and quickly, like really quick shorthand, what happens to me if I get those drugs. That's really critical. If you don't have that somewhere, I think the health app on Apple phones does have a place to put in your drug allergies. The problem is that if nobody thinks to look at that, and they're too busy treating you, they could miss knowing about a drug allergy. So that's really important. Here's the even more important thing that I told him and wrote down for him. When you have a stroke, medical technology is amazing. But you only have a short window to get the right medication. From the first onset of your symptoms, you have 3 hours until that you're able to get a shot called TPA. And this TPA drug is a massive, massive, kind of dangerous blood thinner. But it's also a miracle. You only have 3 hours. After the 3-hour mark, it's less effective. And the hospital that I went to said that they're giving it up to 4.5 hours, even though the FDA has only approved it for up to 3 hours. So, but once you pass that 3-hour mark, the effectiveness is much less. And you say, 3 hours, great. So if I have a stroke symptom, I can sit at home and wait for an hour or two and see if I feel better. No, you cannot. In that window of opportunity, in those 3 hours, before they give you that drug, A, you have to get to the hospital. B, you have to be seen by, the triage nurse and the doctors and everything else. But then you have to have a CT scan of your brain with dye contrast, or contrast dye, in order to know that you don't have any current bleeding in your brain. If you do, they can't give you the drug. And they can't give you the drug unless they know that you don't have bleeding in your brain already. If they give you that and you do have a brain bleed, and that's one of the side effects that could happen, you will die. So they have to do that CAT scan. And even though I had that CAT scan and I had no bleeding in my brain, and they could give me the shot, the first 24 hours after you get that shot, there is a very real risk that you could bleed into your brain and die. And that's why after you get this shot, you are in the intensive care unit for a minimum of 24 hours. So my point is, if you think you or somebody you know is having a stroke, err on the side of caution. Get seen immediately, as fast as you can. I can tell you that I got the shot 2 hours after 2 hours and 10 minutes after my first symptom. At the time I got the shot, I could not speak anymore. I mean, I could speak, but I couldn't fully articulate what I wanted to say. And I was slurring my speech more and more. I'm still slurring. If you don't know me, well, you probably don't even notice. Even if you do know me, you probably don't notice. I my tongue is moving over between my teeth on the right side of my mouth, and it's kind of like I'm calling it a side lisp, and I'll have to work on that. But at the time I got this shot, I could not speak. I could not fully communicate, and I couldn't. My right side I could barely use. I had total, like, really weak. I'm right-handed. Couldn't really make a fist. I was definitely weaker on my right side, both arm and leg. Had a little cloudiness in my right eye, which ironically enough, with everything else going on, I didn't even notice until after I got that TPA clot busting shot. I actually had this, while it was working, this horrific pain in my eyeball. It felt like somebody was pushing my eyeball into my head. And my right eyelid drooped during this time, and it's still a little droopy, but it's better. And when that pain stopped, all of a sudden my vision cleared in my right eye. So I can only guess that that was a clot that was being dissolved by this clot buster. And thank God, because who knows if I would have lost my eyesight as well as my speech. And so within an hour of getting this TPA shot, I was starting to come back. I was starting to get my speech back. Not great, but I could make an intelligible sentence, and still had weakness on the right side, but maybe not quite as much. It is truly a gift if you can get someone this shot within that 3-hour window. My outcome could have been very, very different. So where do we go from here? I have a lot of work to do. I'll tell you the things that I'm experiencing in my next video. I'm going to tell you the things that I've lost or are harder for me now. And I will tell you the things that I am celebrating that I can do. And I'm going to take you along on my recovery journey. I am determined to recover. I know it's going to take a long time to get 100%, back to normal. But I'm determined and too stubborn to fail. So thanks for watching. Thanks for coming along with me on this journey. If you'll please subscribe to this channel, and then you'll be notified when I post new videos. And I am happy to answer any questions you have. I am sharing with you my medical information. I am sharing with you my personal experiences. Again, I want to tell you that I'm not a doctor, I'm not a nurse, I don't work in the medical profession. I am not qualified to give anyone medical advice, but I can tell you what my experiences are, and I can share with you the information that I've gathered, such as that 3-hour window to get the TPA shot after a stroke. And if you have a question and I don't know the answer, I will do my very best to get the answer from a professional. So thank you for watching, and I will see you again next time.